Hey guys, let's do something today. Today is another day. Yep. Okay, let's get going. So today we're going to do part two of the ethical and legal issues in the context of the NCLEX-RN. Okay, question and answers. Okay, if you have not watched the part one, please go check it out and watch it, and I hope you will enjoy it. Let's get going. Question number one. Okay. Okay. A client who is bleeding internally needs emergency surgery but refuse treatment. Which findings is grounds for challenging a client's right to refuse treatment? Select all that apply. Oh, we saw something like this during the last part one of the question and answer. A says client is incompetent. B says the nurse disagrees with the client's decision. C says compelling reasons exist to overrule the client's wishes. D says the treatment would be more cost efficient. E says the healthcare provider does not want to be sued. This is a SATA question, select all that apply. What is this question saying? In other words, it is saying that what are the reasons that you will carry on a procedure without necessarily waiting for consent form in situations like this? In which situations, we saw it last time and we said, let's go by getting the answers first, then I'll give you the explanation. A and C are the right options. Why? Last time we said there are two reasons that you will not need consent. One, when the client is incompetent, okay? The client has waived the right to consent. Two, emergency situations when compelling reasons exist to overrule the client wishes. Emergency situations where treatment might be delayed if you want to get consent, like in this case. We said that last time. So why B and D is not correct? Always respect the wishes of the client. And finance should not be a reason for any reason for you not to carry out treatment. E is inappropriate. Just because the healthcare provider doesn't want to be sued and you think you will not carry out the procedure. Okay, next question. A new graduate nurse is working with the team that set up organ donation. What is the most important concept the nurse must understand about organ or tissue donation before working with the families? Yes, you guys might have seen questions about tissue donation. This is an important ethical area in nursing. Okay, A says it is done with the healthcare provider's approval and written prescription. Okay, let's see. B says the individual requesting does not have to believe in the benefits of organ donation. Is it true? Let's see. C says the individual requesting is knowledgeable about the basics of organ donation. D says the family is offered an opportunity to speak with an organ procurement coordinator. So as a nurse, there are some areas of practice that you might not be skilled. And when situations come up like this, you must channel the family or discussion on those topics to specialists, to those who are concerned. Don't ever get yourself involved in discussions that you are not trained to give information on. So in this case, the right answer is D. The family is offered opportunity to speak with the organ procurement coordinator. These are persons who are trained in this process. So you say, okay, I will get somebody who is trained to speak with you in this area. Okay, very, very important. Either the primary healthcare provider or a nurse specialist or the organ procurement coordinator, discussion can be channeled to them. So the person requesting must be knowledgeable. Of course, you will not be requesting for something that you are not knowledgeable in the process. What I mean here, excuse me, I mean here, the person who has to give discussion, who has to give support, who has to guide the parents in undergoing this process, who has to speak with whoever who is requesting for this donation, who has to speak with somebody who wants to give the organ must be knowledgeable. Okay. B is wrong. The person requesting must believe in the benefit of organ donation and must believe in the process. Okay, that is that. Then, now, the other thing that we need to know when this is concerned is the client has the right to become an organ donor or the right to refuse organ transplantation. Also, an adult of 18 years plus has the right to become a donor. Okay, we're saying the same thing. So, like I said before, make sure that you channel discussions that you are not versed with to those who are knowledgeable and skilled about it to handle. Don't engage in discussion on topics that you are not knowledgeable. Okay, let's move to the next question. 3. The nurse hears a client calling out for help, hurries down the hallway to the client's room, and finds the client lying on the floor. The nurse performs an assessment, assists the client back to bed, notifies the primary healthcare provider, and completes an occurrence report. Another name is incident report. Which statement should the nurse document on the occurrence report? This is very important. You might have come across questions like this. A says, you should document that the client fell out of bed. Or you should document that B, the client climbed over the side rails. C, the client was found lying on the floor. D, the client became restless and tried to get out of bed. Listen. What's the right answer? C is the right answer. The client was found lying on the floor. Now, an incident report is written when situations like falls or any medication error or any incident happen in a facility. And there are steps in writing an incident report and things to do. Number one for us to know, an incident report is used to identify risk situation and to improve client care. In other words, we can say it is used to promote quality care and risk management. It's never used for punishment. It is used for supervision, to identify areas of weaknesses. They track the record. If it keeps happening on a particular nurse, they will now send this nurse for more training. It is not used for punishment. Now, steps you need to follow. When it happens, you should fill out a report completely, accurately. You should have factual description of the occurrence, the injuries, what you did, those involved, and the response. Then you should report to the primary healthcare provider what happened and what you did. Okay? The report form should not be copied or placed in the client report. It is a form on its own. You will keep it and the risk management team will get it. Don't include it in the client's file because it can be used against you or the facility. But like I said, the purpose of the incident report is for risk management to improve care. It is not for punishment. The next important thing is make no reference to the occurrence report form in the client's record. What does that mean? Don't write there that an incident report was filled. That sentence itself No, nothing should be on the report. So in years to come, they don't need to know that something happened. It can be, you can be sued, the facility can be sued. Don't mention that. It is used for risk management, okay? Not for any other purpose. Report must be written within 24 hours and by the nurse who observed the occurrence. You might have come across questions that say, um, your colleague came to take over your shift and there was an incident that happened in your shift. What should you do? Okay, they say, inform your colleague to complete the report or keep it, go home and come do it the next day. No, that is not correct. It has to be completed by the nurse who experienced it, and it has to be done within 24 hours. Okay? So to answer this type of question, focus on the subject, okay? The documentation of the events and know the data in the question to select the right option. I hope you have information about incident report. When you find a question in this area, you should be able to grab that question. Next. Okay. We say an older woman is brought to the emergency department for treatment of a fractured arm. On physical assessment, the nurse notes old and new ecchymotic areas on the client's chest and legs and asks the client how the bruises were sustained. The client, although reluctant, tells the nurse in confidence that her son frequently hits her if supper is not prepared on time when he arrives home from work. Which is the most appropriate nursing response? This question is very important. A, oh, really? I will discuss this situation with your son. B, let's talk about the ways you can manage your time to prevent this from happening. D, do you have any friends who can help you out until you resolve these important issues with your son? D, as a nurse, I am legally bound to report abuse. I would stay with you while you give the reports and help find a safe place for you to stay. Which is the right option? D is the right option. Remember, in part one, we saw a question that had to do with the Nurse Practice Act. And what did I say? I said the Nurse Practice Act requires nurses to report situations like abuse, communicable diseases, criminal activities, violence, domestic violence, dog bite, animal bite, gunshot, stab wounds, assault, homicide, suicide, substance abuse to the right authority. This is the law. This is the law you have to follow. This question is an abuse situation. The right thing, the first thing you have to do is to assure the safety of that patient. Guarantee the patient that you are out to provide safety. Okay? And then report the situation to the appropriate authority. In this case, you can report to your supervisor, who will then report to the right person involved. In this same question, you might have come across a question that says, the mother brings the child to the hospital, and on your physical assessment, you find bruises, and the history that the mother gives does not correlate with what you are seeing. This is a case of abuse. Second, another question is, you are trying to interview this child, and the child tells you, please, if I tell you this, the child is afraid of the parents. And the child tells you in confidence that if I tell you this, please do not tell anyone. What will you do? According to the Nurse Practice Act, you are bound to report. Your right answer is You guarantee the child you are here to provide safety, but you are obliged to report any situation of abuse. Don't lie that you will not tell anybody. You are bound to report. Okay, to give more light on this question, you are working. If you suspect your co-worker is abusing chemicals, we saw a question like that, and she stands a chance of providing unsafe care to the clients, it is your duty to report in confidential manner to the supervisor. Do not inform your other colleagues. Respect privacy and stay on professional grounds. Any sexual harassment at workplace from co-workers or clients, you are bound to report. Okay? So in answering this question, you have to look at important facts. Strategic words most appropriate. Focus on the data in the question and note the older woman is receiving physical abuse by her son. Recall the nursing responsibility related to the client safety and reporting obligations you are bound to do. With this in mind, you will be able to choose the right option. Next question. Question number 5. There are reports that morphine has been missing from the medication room several times during the last 3 months. The nurse walks into the medication room and witnesses another nurse quickly slipping something into the pocket from the control substance drawer. Place the nurse's action in ascending chronological sequence. Use all options. I answered this question already. A, if directed, fill out a confidential incident report describing what was seen. B, approach the nurse manager, nurse supervisor privately and discuss the matter. C, do not share any observation with other nurses on the unit. D, continue to observe the nurse in question for signs of unusual behavior. E, carefully review and document what was observed. Put in chronological sequence. What will you do first, second, third, fourth, and 5? The right order is E, B, A, C, and D. I repeat, E, B, A, C, and D. So what's there is, first of all, do not draw a premature conclusion based on one suspicious incident, okay? Be calming down. Yeah. So what you have to do is to make sure that you first of all review and document in detail what you saw. That is E. Then speak with the nurse supervisor privately and if directed, fill out a confidential incident report describing what was observed. Okay? That's B and A. At this point, the nurse supervisor will follow through for further investigation of the situation. Then the next thing will be you have to maintain professionalism. Avoid spreading potential unfounded rumors, okay? So do not share any observation with other nurses in the unit, okay? And then the reporting nurse, the last thing is to keep an eye on that nurse, okay? Remain alert for the repeated suspicious behavior. That is what you have to do in this situation. Did that make sense? We've come to the 5th question. I have one question for you, okay? This is yours. Drop your answer in the comment section. I will reply the right option to you. Okay? Without which, thank you. Please kindly share, comment, and let me know what you think about the way I answer the questions. Am I too fast? Am I too slow? Let me know. Thank you. See you in the next video.